All right, we're going to continue moving things along here, giving you more updates that have been happening here across our country. And of course, one of the things that Fox has been doing for you is pulling together a lot of those special interviews and stories, not only on coronavirusnow.com, but also right here on our YouTube stream with News Now. So we are going to jump on out with Dr. Mike from our Fox 29 Philadelphia station for his daily update on coronavirus.
Dr. Mike Cirigliano out of Penn Medicine joining us from Philadelphia. Great to see you on this Monday, Dr. Mike.
Always a pleasure, Thomas.
I want to start with some encouraging news coming out of biotech company Moderna, which is based out of Massachusetts. The company announcing it has an experimental vaccine. They're saying so far it is, quote, generally safe and well tolerated. What more do we know?
Well, I'm very excited about this. This is a phase 1 trial of a vaccine, one of many out there, that has been shown to be safe so far. Now, these are 8 of the volunteers they've looked at, safe, and it has produced antibodies. And these antibodies, remember, will neutralize the virus, making it unable to infect cells. So in a time when we really, really, really need good news, this is it. All right, Thomas, I'm telling you, we're on our way. We just got to get going on this so that we can get it to people as soon as possible.
Certainly is encouraging. How does that work, though? You're not positive with the virus. How does your body produce these antibodies?
Well, the good news about coronavirus is that it's got parts of the virus that are very amenable to developing a vaccine. And so researchers take parts of that and develop a vaccine that will go after those parts of the virus. And so even though you have not had the infection, your body thinks it did, and will produce these antibodies. And by the way, from published reports, the amount of antibodies that were generated by this vaccine are the same as those who had the infection. So I'm very excited about this.
So you mentioned this is the first phase of the clinical trial. Phase 1, what does that mean, and what does phase 2 hold?
Phase 1 basically looks at safety. Phase 2, they'll get more people involved, several hundred people. And then hopefully, and this is what's really exciting, phase 3, where they get thousands of people involved, July. Oh my God, let's do it. Let's make this go away. I'm tired. I'm tired of it. Tired.
We're going to have to be watching that trial very closely here. I want to talk about the FDA has given emergency approval, Dr. Mike, to a new at-home testing kit. This one by prescription only. How does it work?
Well, you go online and you fill out a questionnaire. The questionnaire is reviewed by a healthcare provider. They send you the kit and you swab yourself. Now, the only thing that we have to make sure that it's a good technique. And I say that for everyone, because just like anything, if you don't do it right, you might get a falsely negative study. So you've got to go in there. If you saw pictures or the video of Governor Cuomo, man, she went all the way back to the back of his brain and really did a good job. And that's critical to make sure you have an accurate specimen.
You have to get a good sample. So you basically just call up your doctor and your doctor can prescribe this kit?
Well, I think you can go online and someone online will review the application that you filled out. And if you meet criteria, you're in.
I want to talk about the World Health Organization. I know more than 100 countries are now calling on the WHO for an independent evaluation into this pandemic. What are they trying to pinpoint, Dr. Mike?
Well, they're trying to understand where it came from, and the likelihood in my mind is that it came from a wet market. There was transfer from an animal to humans, and I really think that's what's going on now. Like anything, no one really wants to have everything investigated, and I think the president or the premier of China basically said, look, we welcome you after the health crisis comes to an end? Well, when's it may never end. I mean, it may be a year or two. I think that in full transparency, we hear that term a lot, Thomas. Yeah. Everything needs to be out in the open. There's no, look, it is what it is. If they sat on it for a while, it's not going to change anything. But the bottom line is that we really need to know what happened, where it came from, mainly to prevent it from happening again.
I think a lot of people are still trying to figure out what these different agencies do, the NIH, CDC. Can you further explain the role of the WHO, the World Health Organization?
Well, in my experience, having been a physician for decades and decades, the bottom line is that they are responsible. They're the frontline people throughout the world looking at not just coronavirus, but all kinds of outbreaks. And I know they took some heat from President Trump, but they're really an essential organization in terms of getting to the bottom and containing things like Ebola, measles, mumps, rubella. I mean, it's throughout the entire world. And so they are essential, in my opinion. And so that's what their role is. Their role is to find these illnesses, deal with them, and protect the world from things like this.
You mentioned the administration. I want to get your opinion on Health and Human Services Secretary Alex Azar, suggesting that the underlying health conditions of Americans, in particular minority communities, contributed significantly to the death toll from this virus. Your thoughts?
Well, we have seen a disproportionate amount of deaths amongst African Americans compared to their representation in the population. And I believe, this is my own personal opinion, that this brings to light the fact that there are disparities in healthcare in this country. Everybody knows it. We've known it, and something needs to change. This discrepancy leads to an excess of obesity, one of the risk factors, for hypertension, one of the risk factors, for all of the diabetic conditions. These are the conditions that make you more susceptible to this virus. And so to me, this is one of those things that I've mentioned when we talk all the time, that needs to be a positive out of this. We need to get better healthcare to our citizenry, all of our citizenry, so that they are in better shape, so that, God forbid, things like this happen again, they will be in better physical shape.
Yeah, we're certainly re-examining our healthcare system. We've been talking a lot lately about how this virus affects our young. There's a case not too far from you, Dr. Mike, in New Jersey, a baby born just about a month ago, tested positive for the coronavirus. This is out of Atlantic County. Could this be a mother-to-baby transmission?
Well, I don't know all the facts, Thomas. I can tell you that based on conversations with our OB-GYN folks here at the University of Pennsylvania, and going by CDC guidelines, it is unlikely to have direct transmission from a mother to child. In the cases that have been reported in the very, very young, there has been an indication of contamination from a healthcare worker. And so the bottom line is that it's very unlikely. What I would say, though, is there's a lot of people out there who are pregnant, who are very concerned about this. I would have close contact with your healthcare providers to make sure, and of course, practice even more than anyone else, social distancing, and like me, have a designated shopper. My wife has designated me to be the one to go out and get all the food and forage and everything else. I feel very caveman-like.
Well, hopefully she gives you a list there to follow. Dr. Mike, here we are, new week. Do we know any more about this mystery inflammatory illness affecting children?
Well, basically, the numbers continue to rise, Thomas. And so what we think, and what I think, is that it is related to COVID-19. And it is an inflammatory response. And there may have been more cases earlier on that may or may not have been misdiagnosed. So I think that there is, in my humble opinion, a correlation between COVID-19 and this inflammatory response. It's very similar to Kawasaki disease. And if you look at Kawasaki, it is common during epidemics. And the good news here is that there are treatments available. And if you catch it early, and we've said this many, many times, Thomas, you need to make sure if your child has a persistent fever, a rash, redness around the eyes, nausea, vomiting, anything like that, in this current climate, you need to get in touch with your healthcare provider sooner rather than later.
Notice any changes, call right away. Let's get back to some of the encouraging news here. As we mentioned, 24 states have reported a drop in the number of COVID-19 cases reported each day, and I believe about 17 states, Dr. Mike, are showing the numbers are holding steady. Our efforts are paying off?
Well, our efforts are paying off from the past efforts. What I'm worried about, Thomas, is that I witnessed a lot of people on video down on the East Coast shores. And it didn't look to me like all of them were wearing masks. A lot of them were in lines in close contact getting food, a lot of them on the beaches. And so what I'm worried about is that in 2 to 3 weeks from now, we're going to see an uptick. And that worries me a great deal. Yes, we're seeing stabilization. We're seeing that surge come down. But I believe that was based on the fact that we really hit home hard, social distancing and making sure that people do what they're supposed to do. I'm worried a little bit that that may be loosening up right now.
So you're saying this could be a delayed response. What we're seeing now is from about 2, maybe 3, 4 weeks ago. In early June, we could see from last weekend or the next weekend of what people are doing.
That worries me a great deal. Maybe I'm wrong, but I didn't like what I saw. I saw a lot of people with no masks, lots of people in lines. And look, I want to say something. I am all for getting back to business, all right? Getting our economy back. It's not all or nothing. We can do it. We just have to be smart because the virus is smart, and we can be smart and do it the right way because we don't want to go back to where we were a month ago. I really want to look at that in the rear view mirror.
Yeah, all of us certainly do. Once again, we keep adding to the list of symptoms. What are the symptoms to watch out for, and then the incubation period for those symptoms?
Well, most people will get exposed to a virus and develop symptoms anywhere from 4 or 5 days up to even 11 days or so. So there is a lag time. What are the symptoms? Well, they can range from fever, chills, cough, feeling achy, headache, conjunctivitis, that's an inflammation of the eyes, loss of taste or smell, abdominal discomfort, perhaps diarrhea. All of these are potential symptoms. Look, if you're out there in this climate, in this day and age, right now, if you have anything that makes you feel not well, you need to get in touch with your healthcare provider and let us figure out what it may or may not be. And if that's the case, then we will be able to get you tested, and then ultimately we will be able to get your contacts and trace them and do all the things we want to do to limit this virus.
So let's say you go for the test, you test positive, you don't have the severe symptoms, Dr. Mike, perhaps some mild symptoms. What is the best course of treatment?
Well, we like to quarantine people. You self-quarantine. You don't have to go to a hospital. You don't have to go to an emergency room. If you are positive and you have a mild illness, you stay home for 14 days. Now, it's very interesting. Some people have done repeat studies, molecular tests, to see what's going on. And there are some concerns that people may be infectious even 10 days after their symptoms have stopped. No one knows. And so that's why when we do those repeat molecular tests, are we seeing just remnants of the virus that are inactive and not infectious? That's one possibility, making the test positive. Or is there virus there? And this is of great concern in people who are immunosuppressed and people who were extremely ill. That's what we're looking at right now to know what to do with them down the road.
And do we know yet, can you test positive a second time?
You certainly can test positive a second time, Thomas, because of the reasons I just said. So I test you, and then 10 days later, I test you again, it comes back positive, but you feel fine. It might be that that PCR test is picking up remnants of the virus. The virus is not alive. There are remnants of it. It's not infectious. Or is it that you still are infectious because you have a decrease in your immunity? We don't know, and we're working on it.
How soon after you test positive can you test for antibodies? Do you have to wait?
Well, you need time for antibodies to develop. So what I caution people about is, one, if you just got over the viral infection, you probably should wait a bit of time for the body to develop these immunoglobulins. Remember that there are several types of immune responses. There's IgM, which tends to peak early, and then IgG. And so we want to see later on if you are developing the antibodies. I generally tell my patients anywhere from 2 to 4 weeks.
Answering all of our questions, Dr. Mike, our daily reminder, staying safe.
Well, I'm very, very excited about the vaccine that we heard about today. There is progress being made. I want to make sure that people realize that if we don't play this game right, we're going to be right back where we were. And finally, I think that there is light at the end of the tunnel. We have to be positive, but it's an endurance race, Thomas. Now we're not in a sprint, we're in an endurance race to stay healthy, stay alive until that vaccine is available. And then we can kiss this virus goodbye.
We have to take all the right steps. Dr. Mike Cirigliano with Penn Medicine out of Philadelphia. Great to see you, my friend. Stay well.
You too, Thomas. Thank you so much.